Kidney transplant is a fascinating and life-changing surgery. Today, we'll explore the kidney transplant surgery, step-by-step procedure and recovery. We'll take you throughout the stages of kidney transplant surgery, from pre-operative preparation to post-operative recovery, offering insight into what to expect before, during, and after the transplant procedure. Welcome back to the Kidney Zone. I'm Dr. Mo. Before we begin, please remember that this video is for information purpose only. If you have any concerns about your kidney health, it's important to consult with a healthcare professional or with a kidney doctor. Let's start by talking about preparations for kidney transplant surgery. Medical evaluation. Before undergoing a kidney transplant surgery, candidates undergo a thorough medical evaluation process to assess their suitability and fitness for transplantation. This evaluation includes blood testing, imaging studies, cardiovascular assessment, and consultation with various healthcare specialists to ensure that the patient is medically stable and also prepared for the surgery. The next step is finding a donor. The next step also the process involves finding a suitable donor for the kidney. Donor kidneys may come from living donors such as family members or altruistic donors or friends, or deceased donors through the organ donation programs. Donor compatibility, tissue matching, and logistical considerations play a crucial role in determining the donor-recipient match. What are other pre-transplant preparations? In the days leading up to transplant surgery, patients receive pre-operative instructions and medications to prepare their bodies for the procedure. They may include immunosuppressive medications or anti-rejection medications to prevent organ rejection, antibiotics to prevent infections, and other medications to optimize medical stability. These medications are important because the anti-rejection medicine lowers the immunity, and it's very important to be prepared for that. How about the kidney transplant procedure itself? Anesthesia and incision. Kidney transplant surgery is performed under general anesthesia to ensure that the patient is comfortable and is safe throughout the procedure. When the patient is sedated, the surgical team makes an incision in the lower abdomen or side to assess the recipient's native kidneys and create space for the donor kidney. Next step is vascular anastomosis. The donor kidney is carefully implanted into the recipient's body, and the blood vessels of the donor kidneys are connected to the recipient's blood vessels, artery to artery and vein to vein, to establish blood flow to and from the transplanted organ. This step is very important, ensuring adequate blood supply to the donor kidney and facilitating proper kidney function. The next step is ureter implantation. The ureter of the donor kidney, which carries urine from the kidney to the bladder, is connected through the recipient to the recipient's bladder to allow the urine drainage from the transplanted kidney. The ureter implantation ensures proper urine flow and prevents complications such as urine leakage or obstruction. After that step comes the step of closure and recovery. Once the surgical connections are made and the kidney is placed, the donor kidney is securely implanted. The incision is closed with suture or surgical staples. The surgical team monitors the patients closely in the recovery room to ensure the stability and address any immediate post-operative concerns. The patient is then transferred to a hospital room for further recovery and for further monitoring after the transplantation. Now let's talk about the post-transplant recovery and post-transplant care. The hospital stay. Following the kidney transplant surgery, patients typically spend several days to a week in the hospital for post-operative care and monitoring. During this time, healthcare providers assess kidney function, manage pain and discomfort, monitor for any signs of complications, and provide education on post-transplant care. Now let's talk about the anti-rejection or immunosuppressive therapy. Patients receive immunosuppressive medications to prevent rejection of the transplanted kidney by the recipient's immune system. Adherence to prescribed medication regimen is very important and essential for long-term graft survival and for optimal transplant outcomes. After that, there will be follow-up appointments. After discharge from the hospital, recipient undergo regular follow-up appointments with their transplant team to monitor the kidney function, adjust medication regimens, address any post-transplant concerns or complications, and monitor for the kidney function. These appointments are essential for ensuring ongoing care and support for transplant recipients. How about the lifestyle modifications after transplant? Transplant recipients are encouraged to adopt healthy lifestyle and healthy habits, including maintaining balanced diet, engaging in regular physical activity, and avoiding tobacco and excessive alcohol consumption. And also, it's very important to manage any underlying health condition and to support kidney health and overall well-being. So to conclude, kidney transplant surgery is a complex and life-changing procedure that offers hope and renewed health to individuals with end-stage kidney disease. By understanding the step-by-step process of kidney transplantation and the post-operative recovery journey, patients and their loved ones can feel empowered and informed by the healthcare team and embark on this transformation path to improve health and vitality. If you found this exploration of kidney transplant surgery enlightening, consider sharing it with others who may benefit from this podcast. And also, it's very important to understand the importance of the transplant process. So until next time, take care, stay informed, stay hydrated, and take care of your kidneys. And we'll see you in the next episode of the Kidney Zone.